Okay, so some of you may know by my video the other day, I had my pre-op appointment yesterday with Andrew Yelland down at Nuffield Hospital in Brighton. I'm in the midst of writing a massive post to put up on Tumblr detailing like everything that you might possibly want to know about your consultation pre-op. But I thought I'd make a video here as well, sort of as another angle on it. Getting there didn't go as planned. I was originally hoping to get the 22 bus from outside the church to the Nuffield. You could have got the bus from the station, but that took a lot longer because you had to get an earlier bus because it farts around going places first. But it's actually just a 7-minute walk to like this church. All the trains were delayed. We got there with about 25 minutes to spare, jumped straight in a taxi and got that to the Nuffield. It took about 20 minutes and it cost us £11. If you were to pre-book a taxi, it would cost a bit less because they have about £2.80 on the meter anyway because you're getting a taxi from the rank. The door's pretty obvious if you're getting there in a taxi. If you walk in, you just kind of walk down. You go to the entrance, you just walk down and there's a door there. You can't see it on Google Maps, which kind of worried me, but it is pretty easy to see. But yeah, you go in, there's a reception desk there, and you're just like, yeah, I'm whoever, I'm here to see Yelland, take your name, do the usual date of birth, address checks, and doctor surgery. My doctor surgery somehow got mixed up. They got one from over a year ago. I have no idea how they got hold of that address, but I corrected it. Then she directs you down to another little waiting room. Again, you tell them who you're there to see. You just kind of sit there until someone comes and gets you. You'll catch a glimpse of Yelland wandering around, probably, if it's anything like the day I was there. Then you go into the room with Yelland, or you might do the nurses first. They're all perfectly happy to have someone in there with you, if you're happy to have that person in there with you. Yeah, you just have a chat about it, really. He started talking about it and then I was like, right, we'll do the examination bit. So they've got a bit more to base it, personalise it, or what they're saying to you. So there's a curtain, and you go behind the curtain. The woman kind of loiters at the end. Sorry, the nurse. The nurse kind of loiters at the end, which is a bit uncomfortable. But she doesn't stare at you while you get undressed. You just waits till you get undressed and then calls Yelland in. It's kind of pretty quick, so you haven't got time to mull it over and everything. And I just kept looking straight ahead, so I didn't see my chest at any point, and that kind of helped to forget why they were looking at my chest, or what it was that they're actually looking at. Then Yelland comes in. He's got a really old camera, not like really old, but by these days standards it's pretty old. Takes a couple of pictures of you. We're kind of discussing procedures, and I said about, well, up until recently I hadn't been sure whether I'd be able to have periareolar surgery, and he was like, oh, definitely, you can definitely have that. And then because we were discussing that, he then was just like, can I touch you? And then touched, or more like pinched my chest, to see how much tissue there was there. Yeah, that wasn't too bad for me. It was pretty clinical. It wasn't like a grope from the front, it was the pinch from the side. Just a couple of seconds, and then he went and got a tape measure and measured from, I think it's the sternal notch. It's like the dent in here between your two collarbones and the base of your neck. From there down to my nipple on both sides. I don't think they'd have to touch your chest if you weren't having periareolar, from what I could tell. And then he was like, yep, done. Put my clothes back on. That's the one thing I wasn't particularly happy about, was I didn't seem to have much chance to rearrange my chest. Once I put my binder on, the nurse was like, whipped the curtain across, and I don't like doing it in front of people, so I felt kind of rushed there. Yeah, we then started talking about 2 different procedures. He drew some diagrams and I explained it all pretty simply. Like, really matter of fact is like, some people do this, I don't know why, like, that's ridiculous. You can tell that he just wants to give you the best that he can. Yeah, it's just really matter of fact. He knows he's good, not in an arrogant, cocky way, but he realises that he's good, and that's what he aims to be. And I find that quite reassuring. He's quite funny as well, and his way of explaining things is quite basic. It's not a load of medical jargon that he throws at you. He was saying that with a periareolar, it can take like 6 months to a year to really look how it's going to look. And while the same can be argued for double incision, there's more of a immediate effect. He said that 95% of the population don't have the option of periareolar. Whether that's his idea of who is eligible for periareolar or in general, I don't know, but like the vast majority have to have double incision. He kept saying you can have the choice of both, and I kind of kept pushing him to say, well, no, I don't really want you to opt for periareolar, because it's a decision that I'm really struggling to make myself. And he was fine with the fact that I was struggling with it. He wasn't like, oh, you're really not prepared for surgery, you know, you must have decided. He was like, you know, take your time, I'll ask you some more questions, give you a bit more time to think about it. Went through some medical history, just talking about risks, any concerns I had, family history, that sort of stuff, allergies, whether I smoked. He thought it was pretty funny that I smoke one a day. He's like, is there any point writing that down? Oh, I suppose I better. And then kind of got to the end of it, and I was like, no, I'm gonna go for periareolar. Yeah, that was quite a big moment for me to say that, and I immediately followed it up with, what would happen if I changed my mind? And he was absolutely fine with the fact that I might change my mind in the next 2 weeks. Just like, yeah, give us a call if you know before the date, or on the morning of surgery you can change your mind. It's just been signing another bit of paper. So yeah, that's what I opted for. I'll probably have to do another video on all of that stuff, but at the moment that's what I'm going for. That was about it with him. I was told just to go and sit and wait for a bit between the appointments because I'd finished earlier than the nurses were ready for me. I was told I could get something to eat and a drink, which was quite reassuring because I wasn't sure whether the blood tests they do are fasting or not. So the blood tests are not fasting for them. You then go in to a little room with the nurses. Again, they're happy if someone comes with you. She asked if she could call me Alex. I don't know whether that's like, have you changed your name sort of thing, or because I'd put down Alexandra on the form. Checked all the details on the form are correct, went through to see if there's any questions about it or any bits that I'd missed off, because I'd left the diarrhoea question and part of the drinking question because I didn't really know what to tick, because I drink every couple of months and I didn't want to put diarrhoea because I thought I'd jinx it. If I say I don't have diarrhoea when I was filling it out 4 months ago, I'd probably go and have diarrhoea. Does your height and weight, the standard shoes off, stand on a thing and whatever. They take your temperature with this infrared thing. Mine was high by 0.5 of a degree. And they swab you for MRSA, which was really bizarre. They've got like a really long cotton bud swab, so they dip in some water or liquid of some sort, and then they swab both your nostrils, which is pretty grim. Then you get a new one, dip it in the water, and swab your armpits. Again, they do both sides. That was a little bit uncomfortable for me because I was bullied for having armpit hair as a kid, and whilst I like having it, I worry that other people will judge me about it a little bit still. Then the third one, they do your groin, but they'll draw the curtain across, leave, and let you swab that yourself, so it's not particularly uncomfortable. They also do your blood pressure, and then take some blood. It's 3 of the vials of blood, which is actually the best I've had for a long while taking my blood. The amusing thing was she kept asking me if I was alright while my girlfriend was feeling ill behind the curtain, because she'd kind of drawn it across a bit, because I was like, don't you dare look at this. Right, so they also went through a little bit of paperwork with you with the nurses, talking about what you do on the day before going home, everything. They talk about how you've got to wash with this the morning before, and then put clean clothes on, and no deodorants, fragrances, talcum powder, any of that stuff. And they also got like another package booklet thing for you. They take the one that you've been filling out off you. I'm guessing they then give it back to you at some point, because they add stuff to it, like your height and your weight and all that stuff. So what is in here is wound care, like what to look out for, how to look after your stuff afterwards. And they give you the number of the ward and everything. There's a thing about patient consent, a thing about DVT, why you've got to wear the lovely stockings that they make you wear. Also got a handout on infection showering and all that stuff. And then the booklet itself, It's just a couple of pages of information about, like, once you've done with surgery. It's generic stuff, because you're not going to be driving 24 hours after surgery. What's normal, what's not so normal, stuff about painkillers, and like medication and whatever. She says to bring it in with you, because there's a checklist at the back where they can put in information that you might otherwise forget, like what pain relief to have, and if you've got stitches that need removal and all that stuff. And that's about it. I thought I'd have to pee in a cup. I didn't have to pee in a cup, and that annoyed me because I hadn't had a pee since I was at Gatwick Airport. I was getting the train through Gatwick Airport, I wasn't flying down. Yeah, that really was it. It's really clean, it's really relaxed, everyone's really friendly. It's just fantastic there, really. You're not made to feel other or different. It's all really respectful as well. And there was a couple of questions actually that they needed to ask you about pregnancy, and these she didn't read out. Everything else she was asking me aloud, but these she just pointed to them on the sheet, so that was less triggering, I guess. And she seemed mortified when she said she realised that she'd said don't put any perfume on after you shower in the morning before surgery. And she was like, oh, aftershave or whatever. You know, it's a genuine mistake. It wasn't like I don't see how you could take that personally. It's just a generic thing of perfumes, like fragrances. It wasn't a slight or anything like that. Yelland does a lot of good man. That's the kind of guy he is. Yeah, they're all just brilliant, friendly. I don't have a bad word to say about them so far, apart from the fact that there's like no internet reception or phone signal on O2, but they do have Wi-Fi, so yeah, hopefully when I'm actually there that'll be alright. Travelling back, I got the 22 bus. There's a bus stop right outside, like heading in that direction. I've got the app on my phone, so I could just show the bus driver and get on, but they do take coins as well, and I'm pretty sure they give change as well. So, like, they're not like some buses that insist on exact change, or maybe that's just a Swindon thing, I don't know. Yeah, so the bus journey was fine. I get stressed out about buses, but that was all good. And that's everything I can think of to put in this without going into crazy amounts of detail. I will, again, when I finish this post, I will link to it, and if there's any questions or anything you want to know about the surgery, just let me know. I'll do my best to answer. The only other thing to say is that my surgery is on the 23rd of November, if you want to wish me luck or something.